There's a conversation most men over 60 have never had, and it quietly decides whether you sleep through the night, feel confident leaving the house, or even enjoy a long car ride without planning bathroom stops. I'm Dr. Julia Morgan, board-certified urologist, and for the next while, I want to give you 5 practical, evidence-informed daily habits that can change life after 60. Not with hype, not replacing medical care when it's needed, but with real steps you can start tonight. Before we get into the habits, tell me in the comments where you're watching from, and if you drink more water in the morning or spread it through the day. I want to see how many of you already do this. Let's begin with a very quick, concrete picture of what we're dealing with. Think of the prostate as a walnut-sized collar sitting around a straw. That straw is your urethra, the tube that carries urine and semen out of the body. As the collar grows tighter, the straw gets pinched. That's essentially what happens with benign prostatic enlargement, commonly called BPH. It's not cancer. It's often an age-related change that can make the stream weaker, create a sense of urgency, leave you feeling like your bladder isn't empty, and prompt multiple trips to the bathroom at night. Imagine the bladder as a water balloon attached to that straw. If the flow through the straw is limited, the bladder works harder to push urine out, and over time, it can become more sensitive and prone to urgency. Now add common daily things. When you sit after a big meal, blood flows away from the pelvis toward digestion. When you don't sleep deeply, the body's repair systems lag. When fluids are concentrated at night, the bladder gets irritated. And you can see how lifestyle nudges can either tighten that collar further or help ease the strain. Medical institutions like the Mayo Clinic and Cleveland Clinic emphasize that while aging and anatomy matter, symptoms are heavily influenced by lifestyle factors: fluid timing, movement, diet, sexual health, and sleep. Studies in respected journals, including the Journal of Urology and research from universities such as the University of Sao Paulo and Harvard, consistently show associations between daily behavior and urinary symptoms or prostate disease risk. I'll reference these as we go so you know this is grounded in evidence. Now to the 5 habits. For each, I'll explain why it matters, what the evidence says, and exactly how to do it. Small, consistent changes, done over weeks and months, are what produce meaningful improvements. No guarantees, but real chances for a better quality of life. Habit 1. Strategic hydration. Most men assume more water is the solution. The missing piece is timing and concentration. When urine is very concentrated, it irritates the bladder lining and can trigger urgency. Heavy drinking right before bed fills the bladder when you want sleep, and sudden large volumes can overwhelm pelvic circulation and nerves. Now to the 5 habits. For each, I'll explain why it matters, what the evidence says, and exactly how to do it. Small, consistent changes, done over weeks and months, are what produce meaningful improvements. No guarantees, but real chances for a better quality of life. Habit 1. Strategic hydration. Most men assume more water is the solution. The missing piece is timing and concentration. When urine is very concentrated, it irritates the bladder lining and can trigger urgency. Heavy drinking right before bed fills the bladder when you want sleep, and sudden large volumes can overwhelm pelvic circulation and nerves. Conversely, consistent, moderate hydration throughout the day keeps urine diluted and reduces irritation spikes. Mechanism in plain terms. Dilute urine is gentler on the bladder lining. Steady sipping prevents the bladder from being suddenly overfull, and avoiding heavy fluid intake close to bedtime reduces nighttime awakenings. Think of it as avoiding sudden pressure surges in a garden hose. Steady flow is easier on the system. What the research shows. A study published in the Journal of Urology looked at strategies to reduce nocturia, waking at night to urinate, and found structured fluid management was associated with significant reductions in nighttime trips for many men. While individual results vary, the data supports that timing and distribution of fluids can help. How to do it today. Start with morning hydration. Begin your day with a full glass of water before your first coffee. That jumpstarts circulation and helps your body rehydrate after sleep. Sip steadily. Aim to take small sips, about half a glass, every 30 to 45 minutes through the morning and afternoon rather than gulping large amounts all at once. Taper before bed. Stop drinking heavy volumes about 2 hours before your planned sleep time. That gives your kidneys time to process fluids and reduces overnight pressure. If you exercise or it's hot, add a pinch of mineral salt or a squeeze of lemon to your water for electrolytes. Or choose a light, balanced electrolyte option, but avoid sugary sports drinks. Track it. For a week, note how many times you get up at night and when you last drink before bed. Small data helps you see patterns. A short patient example. Alan, 68, told me he used to drink a big glass of water just before bed out of habit. He was waking 3 or 4 times a night. We adjusted his routine to steady sipping and cutting fluids 2 hours before sleep. Over 6 weeks, his nighttime trips dropped. He said sleeping through the night felt like a small miracle. Not every man will have that dramatic a change, but many report measurable improvements within a few weeks. Mini hook before the next habit. Most men sit after dinner, and that might be making things worse. Habit 2. Walk after meals, 10 to 15 minutes. Your body redirects blood flow after you eat to support digestion. That's normal and useful. But if you sit or lie down right after a meal, the pelvic circulation and gentle muscle activity that support bladder and prostate health remain low. A short walk after eating helps redistribute blood, supports glucose handling, and promotes pelvic blood flow, which in turn can reduce inflammation and improve urinary function. Mechanism. Walking lightly increases overall circulation, including to the pelvis. It helps prevent blood being shunted exclusively to the gut, supports stable blood sugar levels, which matter to nerve health, and reduces overall inflammatory signaling. Think of your pelvic area as a garden that needs gentle watering and movement. Sitting for long periods is like cutting off the sprinkler. Evidence snapshot. Researchers at the University of São Paulo reported that men who engaged in regular post-meal walking had a significantly lower likelihood of developing moderate to severe urinary symptoms compared to men who stayed sedentary after meals. Other studies support postprandial activity for improved glycemic control, which indirectly helps nerve and bladder health. How to do it today. Make it brief and consistent. Aim for a 10 to 15-minute easy walk after each main meal. That might be after breakfast, lunch, or dinner, or at least after dinner if doing all 3 isn't realistic. Intensity. Keep it light to moderate, brisk enough to get your circulation going, but not exhausting. Think of a pace that engages your legs and breathing comfortably. Indoor options. If weather or mobility limits you, march in place, walk laps in your home, or use a treadmill at a slow setting. Even standing and doing gentle leg movements while holding onto a counter is helpful. Frequency. Shooting for daily is ideal, but even 4 to 5 times a week creates benefit. Timing. Try to start within 10 minutes of finishing your meal and avoid heavy exertion immediately after a very large meal if you have heart or lung conditions without prior medical clearance. Patient vignette. Robert, 71, had begun to accept needing frequent daytime breaks during errands. He started a routine of a 12-minute walk after lunch and dinner. Over 3 months, he noticed less urgency and fewer sudden urges when he left the house. He described the effect as, "My bladder feels less jumpy." That's the kind of steady improvement consistent with increased pelvic circulation and better metabolic stability. Mini hook before the next habit. This next topic is the one many men are reluctant to talk about, but it has real, measurable benefits. Habit 3. Regular intimate activity, clinical perspective. This is a sensitive area, so let's be clear and clinical. Regular sexual activity and ejaculation can help the prostate by promoting fluid turnover, reducing stagnation inside prostatic ducts, and supporting local circulation. It also influences hormones and can have positive effects on mood and intimacy, which indirectly reduce stress and inflammation. Mechanism. The prostate produces part of the fluid that composes semen. Periodic emptying through ejaculation helps prevent buildup and stagnation. Sexual activity increases blood flow to the pelvis, which can reduce inflammation and maintain tissue health. Hormonal signaling associated with regular sexual function may also support overall prostate well-being. Research context. Large-scale epidemiological studies, including long-term analyses associated with Harvard researchers, have found correlations between higher ejaculation frequency and a reduced risk of prostate cancer in some cohorts. Be careful. These studies describe associations, not cause and effect, and they're one data point among many. Still, the consistent theme is that sexual health is part of overall prostate health. How to put this into practice? Make it about consistency, not performance. The goal is regular, gentle sexual activity or ejaculation as appropriate for you and your partner. That may mean once a week for some men, several times a week for others. There isn't a universal number that applies to everyone. Quality and comfort matter. If sexual activity is painful, difficult, or causes bleeding, that's a sign to consult your healthcare provider. Emotional intimacy helps. Stress and anxiety worsen urinary symptoms. Healthy sexual relationships reduce stress hormones that can amplify inflammation. Alternatives. For single men or those without partner activity, masturbation is an acceptable, private, and clinically appropriate form of prostate clearance. Respect personal values and medical circumstances. If you're on medications that affect sexual function or have cardiac conditions, check with your physician about activity level. Patient vignette. Mark, 67, and his partner found that after resuming a more regular intimate life, they both felt less nighttime urgency and improved mood. Mark reported fewer intrusive thoughts about needing the bathroom and more restful sleep. Again, individual responses differ. For some men, the effect is more subtle, but sexual health is a legitimate part of prostate care. Mini hook before the next habit. Food is medicine, and it can tip the balance toward inflammation or calm. Habit 4. Strategic eating for prostate support. Diet influences inflammation, hormone balance, and cellular repair. Certain nutrients, lycopene, zinc, omega-3 fatty acids, and compounds in cruciferous vegetables are associated with prostate health. Conversely, diets high in processed meats, excessive saturated fats, and sugary junk foods can raise inflammatory markers and metabolic risk, which indirectly affect prostate symptoms. Mechanism. Nutrients affect the prostate through several pathways. Antioxidant protection reduces oxidative stress in prostate cells. Zinc supports cellular repair and immune function in prostate tissue. Cruciferous vegetables contain compounds like sulforaphane, which influence hormone metabolism and inflammatory signaling. Together, a balanced plate helps control systemic inflammation that can amplify urinary symptoms. Evidence highlights a number of observational studies and nutritional analyses, as summarized in publications affiliated with institutions like Harvard School of Public Health and Cancer Epidemiology Reviews, show that diets rich in tomatoes, cooked tomatoes are higher in bioavailable lycopene, vegetables, and healthy fats are associated with better prostate outcomes. Again, these are associations. Diet does not guarantee prevention or cure, but evidence supports diet as a modifiable factor. Practical, realistic steps you can adopt. Use a stoplight plate as a simple visual. Fill half your plate with colorful vegetables, green, red, orange. 1/4 with lean protein, fish, beans, poultry, and 1/4 with whole grains or healthy starches, sweet potato, brown rice. Cooked tomatoes. Include cooked tomato-based dishes 2 to 3 times a week. A small bowl of tomato sauce over whole grain pasta or stewed tomatoes with olive oil can be a practical source of lycopene. Pumpkin seeds and seafood. Enjoy a handful of pumpkin seeds as a snack or add them to salads. Include fatty fish like salmon 2 to 3 times weekly for omega-3s and zinc-rich options like shellfish or legumes for zinc. Cruciferous vegetables. Add broccoli, Brussels sprouts, cabbage, or kale several times a week. Light steaming or roasting preserves beneficial compounds. Limit processed meats and fried foods. Try to reduce intake of hot dogs, bacon, and heavily fried items. These foods are linked to higher inflammation markers in multiple studies. Small, sustainable swaps. Swap a sugary snack for a piece of fruit and nuts. Use olive oil instead of butter. Make at least 2 dinners a week plant-forward. Simple meal example. A plate with oven-roasted salmon, a generous side of steamed broccoli drizzled with olive oil and lemon, and a small serving of quinoa with a tomato-onion relish. It's balanced, palate-pleasing, and aligns with what the evidence suggests. Patient vignette. George, 72, adjusted his plate gradually. More vegetables, fewer processed snacks, and a weekly tomato-based stew. Over several months, he experienced less urinary urgency and reported more energy. He also lost a few pounds, which can reduce pressure on the bladder and improve symptoms. Mini hook before the last habit. All the habits above are amplified or undermined by how you sleep. Habit 5. Deep, restorative sleep. Sleep is the time when your body repairs tissues, balances hormones, and resets inflammation. Poor sleep increases systemic inflammation and disrupts the hormonal milieu that supports healthy prostate tissue. Worse, fragmented sleep directly worsens the experience of nocturia. If you wake frequently, each awakening becomes a cue for the bladder. Mechanisms in plain language. While you sleep, melatonin and growth hormone support cellular repair. Disrupted sleep elevates inflammatory molecules that can affect prostate tissue and bladder sensitivity. Additionally, poor sleep affects insulin and cortisol rhythms, which in turn influence tissue health and nerve function. Research context. Epidemiological studies in cancer and urology literature have demonstrated links between chronic sleep disruption and higher risks of certain aggressive prostate conditions. Other research connects poor sleep quality to increased nocturia and reduced quality of life. This isn't to fearmonger, it's to show that sleep matters to this part of your health. Practical sleep hygiene steps that work. Cool, dark, and quiet. Aim for a bedroom that's cool, about 60 to 67 degrees Fahrenheit or 15 to 19 degrees Celsius if possible, very dim, and free from disruptive noises. Darkness helps melatonin production. Consistent schedule. Go to bed and wake up at the same times every day, even on weekends. Your body thrives on rhythm. Avoid large meals and caffeine close to bedtime. Try to finish heavy meals at least 3 hours before sleep and limit caffeine after mid-afternoon. Stop fluids 2 hours before bed. This complements the hydration strategy by reducing overnight kidney load and bladder filling. Reduce screen exposure. Dim screens at least an hour before bed or use blue light filters. Consider reading, gentle stretches, or breathing exercises instead. Address sleep disorders. If you snore loudly, wake gasping, or feel excessively sleepy during the day, you might have sleep apnea, which increases cardiovascular and metabolic risks. Sleep apnea also correlates with worse urinary symptoms. Seek medical evaluation if these signs are present. Include winding down routines. A short walk, light stretching, or a relaxation practice before bed can lower evening cortisol and prepare you for deeper sleep. Patient vignette. A patient in his late 60s complained of fragmented sleep and frequent nighttime bathroom trips. After adjusting his sleep schedule, reducing evening fluids, and seeking evaluation for suspected sleep apnea, he reported fewer nighttime awakenings and more energy during the day. Sleep was part of the puzzle, and fixing it made other habits more effective. Putting the 5 habits together, what they do as a system. Taken as a whole, these 5 habits form an integrated approach. Strategic hydration reduces bladder irritation. Walking after meals preserves pelvic blood flow and metabolic balance. Regular intimate activity supports local fluid turnover and circulation. An anti-inflammatory, nutrient-rich diet supplies the building blocks for tissue health. And restorative sleep allows repair and hormonal balance. Together, they reduce the triggers that make urinary symptoms worse and support a healthier prostate environment. Think of it as building a shield for prostate vitality. No single habit is a magic bullet, but the combination adds up. Small changes, maintained over weeks to months, can alter symptom patterns and often reduce symptom severity and frequency. A few more practical notes and caveats. Track progress. Keep a simple log of your fluid timing, walks, sleep hours, diet choices, and urinary frequency. Seeing trends helps you and your clinician make tailored adjustments. When to seek medical care. If you experience sudden inability to urinate, blood in the urine, severe pain, fever with urinary symptoms, unexplained weight loss, or rapidly worsening flow, seek medical attention promptly. Lifestyle is powerful, but it is not a substitute for medical evaluation when red flags appear. Medications and procedures. Some men need medications or procedural interventions to manage severe symptoms or complications. These habits complement medical treatment and can sometimes allow dose reductions or improve outcomes, but they do not replace medical advice or necessary interventions. Individual variability. Genetics, prostate size, coexisting conditions like diabetes or neurologic disease, and medications all influence symptoms and responses. Work with your healthcare provider to tailor approaches. More on evidence and balance. I want to be transparent about the science. Studies from respected institutions like the Mayo Clinic, Cleveland Clinic, University of Sao Paulo, and research published in the Journal of Urology and epidemiological work connected to Harvard provide consistent signals. Lifestyle factors are associated with symptom burden and disease risk. For example, structured hydration strategies have been associated with reductions in nocturia frequency, and post-meal activity correlates with lower odds of severe urinary symptoms. Higher ejaculation frequency has been linked with lower prostate cancer risk in some observational cohorts. Diets high in plant-based foods and healthy fats are associated with more favorable prostate outcomes. Sleep disruption shows associations with worse outcomes, but most of these findings are observational, meaning they describe links rather than definitive cause and effect. That's why a practical, conservative approach, adopt these habits while staying current with medical care, is prudent. Common questions I hear. Will these habits shrink my prostate? Lifestyle habits don't necessarily reduce gland volume in a dramatic way, but they can reduce symptoms and improve bladder function and comfort. They can also improve your response to therapies and your overall well-being. How long until I see improvement? Some men notice fewer nocturnal trips or less urgency within weeks of changing fluid timing and sleep habits. Other improvements, like those from diet changes or increased activity, may take longer, months, to be clearly felt. Is sexual activity dangerous if I have prostate problems? In most men, regular intimate activity is safe and beneficial. If you have specific medical conditions or are recovering from prostate surgery, discuss timing and activity level with your surgeon or urologist. Are there supplements I should take? I generally recommend getting nutrients from food first. If a clinician recommends supplements for specific deficiencies, like low zinc levels, follow evidence-based advice under supervision. Avoid high-dose, branded recommendations with no medical oversight. A few short patient stories to close the practical section. Alan, 68, altered his fluid timing and reduced his nightly intake. He went from 3 nighttime awakenings to 1 or none on many nights. His mood improved simply because he felt rested again. Robert, 71, started 12-minute walks after meals. He noticed that grocery shopping and errands were less stressful because the sense of urgency receded. Mark, 67, and his partner returned to more regular intimacy. Mark reported fewer intrusive urinary thoughts and deeper sleep. George, 72, shifted to a more plant-forward plate and cut down fried foods. He felt steadier energy levels and reported fewer urgent episodes. Closing. What to do next? Start simple. Pick one habit you can adopt tonight. If you're waking at night, begin with strategic hydration and sleep timing. If you sit after every meal, try a short walk after dinner. Give a habit 3 to 8 weeks and track change. Share your progress with your healthcare provider and use what works as part of your overall plan. You have far more control than you may think. These habits are about daily choices that restore circulation, reduce inflammation, and allow your body's repair systems to work. They are not a promise of cure, but they are practical, low risk, and often life improving. Before you go, please do me one thing. Tell me in the comments which habit you'll start this week and where you're watching from. If this video helps you, share it with a father, brother, or friend who'd benefit. And if you haven't already, consider subscribing for practical, evidence-based tips on men's health. Medical disclaimer. This video is educational and informational and does not replace individualized medical advice. If you have sudden or severe symptoms, such as inability to urinate, blood in the urine, fever with urinary symptoms, or sudden worsening of symptoms, contact your healthcare provider or seek emergency care. Discuss any lifestyle changes, new exercise routines, or concerns with your clinician, especially if you have other medical conditions or take medications. Thank you for trusting me with your time. Start small, be consistent, and know that practical changes can lead to meaningful improvements. Your prostate doesn't have to control your life. You have the tools to influence how it affects your days and nights.